Thank you, Mr. Chairman. Ms. Tavenner, welcome. Thank you for your service and willingness to come up here and answer all these questions today. I want a couple things real quickly. I'm interested in this, the physician supervision of outpatient therapeutic services in a 2009 Medicare PPS final rule in which CMS issued a new policy regarding direct physician supervision of outpatient therapeutic services. There are a lot of healthcare organizations that have recognized this as a burdensome and unnecessary policy change, but CMS characterized it as a clarification. And it seems as if CMS retroactively interpreted the policy to require that a physician provide direct supervision instead of general supervision and be physically present in the same outpatient department at all times when outpatient therapeutic services are furnished. And I'm concerned that the clarification is in fact instead a significant change in Medicare policy that would place considerable burden on hospitals, especially facilities in rural areas. And so I know there's been a panel convened, but I'm also concerned that that panel is not sufficiently considering the input from rural critical access hospitals. And so I'm wondering if you would agree to return to the pre-2009 interpretation of this policy for critical access hospitals.
Senator Thune, I appreciate that question. And after we talked yesterday, I thought there were a couple of things that we could do. First of all, and I think we discussed this with your staff yesterday, adding additional members representing the rural hospitals and critical access hospitals would be helpful so that we make sure we have a balanced dialogue about what direct supervision really means and what's required in these smaller hospitals in remote areas. I will go back and take a look and sit down with your team. I think we've made some progress, and so I would want the opportunity to sit down with your team and walk through what has been done, but we are certainly willing to look at the original standards and see where we're different.
I guess my concern in all this, and which I voiced to you yesterday, is that there's not a sufficient avenue for rural voices to be heard in this process when the panel is predominantly from non-rural facilities. And so I would appreciate any consideration that you could give the input from rural hospitals. And so, and the other question I wanted to raise with you is I've been hearing from constituents in South Dakota about the impact of preferred pharmacy networks in the Part D program. For some seniors, they're not even aware of the preferred network until after open enrollment for Part D. And for some seniors, it means the drug plan that they've been using for several years has changed. And those changes increase co-pays to go to their regular pharmacy instead of the pharmacy in the new preferred network. For some pharmacies, this is having an adverse impact, as you might expect, on their client base. And I'd like to know what's being done to ensure that seniors are aware of the impact of choosing a Part D drug plan with a preferred network and what that might mean in terms of them being able to access their pharmaceutical services from the pharmacy that they've been using previously.
Senator Thune, after we talked about this one yesterday, I also went back and did a little homework last night in this area. And I think we certainly try to educate beneficiaries about the plan they're in and what that's involved, what pharmacies are in the network. But we need to do more in that area, obviously, if beneficiaries are still confused. So that's the first area. The second area, and I think based on your feedback yesterday, is we need to take a look at the policy and see if there are changes that we can make in the policy in the future that might make it a little easier on this issue. So I appreciate that. Was not as aware of that issue until we talked, and so we will follow up with it.
Okay. I thank you. I appreciate your responses, and Mr. Chairman, thank you. I yield back the balance of my time.
Thank you, Senator.